Dr. Huang, I have to say, when it comes to dental health, this is one of those subjects that I am excited to talk about, but in the same breath, it's one of those unnerving topics in my household when it comes to dental health. So thank you for coming on today because I have a lot of questions.
Thank you so much for having me. I mean, I feel the same way.
Well, I would love to know how, because your practice really does focus on cosmetic dentistry. I mean, obviously health is all a part of that as well, but what made you choose cosmetic dentistry over any other part of dentistry?
Well, our practice is a full service practice. I do a lot of cosmetic dentistry, but that's not where we started. And the core of our practice is still general dentistry, which is the basis of everything, right? When I started my entrepreneur journey, which was about 5 years ago, I was just out of residency. And I worked in 4 different practices. And what I saw in the practices really wasn't what I had envisioned dentistry to be. It was, coming to the practice, looking for cavities and just fixing what was broken. And it wasn't, it was also at the time, the profession was a male dominated profession.
Oh, yeah.
It was very difficult to get started as an entrepreneur, as a female entrepreneur at the time. I didn't really see a lot of focus on people connection and services, which was really important to me. So after about 9 months of working at other practices, I took some time off and I did a lot of traveling. And I found myself in Paris in one of the trips and just surrounded by beauty. And I remember I sat down in a coffee shop and I had this little notebook that I had with me. And I never travel with notebooks. I happened to get it from a store. And I just started writing down and just drawing the vision that was in my head of how I wanted my dream brand to feel like and how it would make other people feel. And that's really where the inspiration from Les Belles came from. It means the beautiful in French.
I love that because I often say, a lot of times we have these moments of inspiration. I really do feel like writing it down or somehow verbalizing it actually helps actualize it. And your practice is really thriving. It does amazing work. I would love to dive into dental health first, because it's very funny because I think of, we all try to take care of ourselves. We go and get our checkups. And if something's not well, we go and take care of it. But dental health is one of those things that I think freaks people the heck out. 99% of the time when you go to the dentist, you're like, I'm going to have a cavity. I'm going to have something, or they're going to have to drill, all these different things. Yeah. But I think it's really, we had a conversation. We were talking a little bit about the correlation between your physical health and dental health. So could you expand on that? Because I found it fascinating.
Yeah, I just feel like there isn't enough focus or coverage, or dental health is more hidden. I don't see a lot of information out there. And I feel like a lot of people, there's a disconnect between dental health, the mouth, and the rest of our body. Most people don't know that the biggest challenge in dentistry is not cavities. Cavities could be fixed in one visit, but the biggest challenge in dentistry, it's really the bacteria that's in our gum. It's gum disease. And the gum disease, the bacteria that's in the gum travels through the entire body.
Oh, wow.
Yeah.
And it's funny because I've had conversations with dentists before where they talk about gum disease and really making sure that you're taking care of your gums, but I've never really made that connection. How do you think it would affect the body though?
The bacteria, the same bacteria that lives in the gum, travels through the bloodstream, and it causes inflammation in different parts of the body, and it could actually land on organs. For example, the heart. It could cause inflammation in the heart. And from the statistics, people with gum disease have 2 to 3 times the higher risk of having a heart attack,
Wow.
stroke, or other cardiovascular events. And it really could impact the longevity and the quality of life. And I don't think that people know that. People think that flossing, which is most people avoid flossing. Most people think that flossing is to get food out in between their teeth. But the real reason to the why that we're flossing is really to go under the gum and to sweep out the bacteria that's hiding in the gum and living in the gum.
So that's fascinating because I know that, we talk about gingivitis, bad breath. I mean, I think that a lot of us just think of the immediate, oh, I should floss so that way you don't have that going on. But in the long run, it really is about good health throughout your whole body.
Yeah, and the reason why we're flossing and getting the bacteria out is so that the bacteria is not living in the gum and getting into the bloodstream and traveling throughout the entire body. We want to get that bacteria out of the gum on a daily basis, and also to maintain that over time, right?
So I want to ask your opinion on something. When it comes to flossing, are you you suggest more of the old school floss, string or those picks, or are you into the whole water pick thing? Because someone recommended a water pick to me and I'm like, that seems like an extra thing.
So what I like to tell patients is any type of flossing is better than not flossing.
Okay.
So really the gold standard is still the string floss that we're able to wrap around the tooth to go deep into the gum to sweep bacteria up.
Okay.
The water floss is good for patients who are obviously not going to do that, or that's a good start to get in a habit of flossing and just flushing out the bacteria. It takes care of that space in between the teeth, but it really doesn't go under the gum. From all the research, the dental research, it's still the mechanical removal of the bacteria that is the most effective. But if that means someone's not going to floss, then use what fits the lifestyle. It's really a lifestyle. It has to fit the lifestyle. If the water floss or the water pick is something that you could travel with, then use that.
But it's not necessarily better.
It's not a replacement.
Okay.
Mm-hmm. It's an adjunct.
That's interesting. Because I thought that because those water picks can be very expensive. I always thought, because they're so expensive and it's this whole unit that's on your countertop, that this is the gold standard, but really just a regular floss is better.
Regular floss is still the most effective way to get into the gum. The gum space is very small, and really the contact between the floss and the tooth, and a tight contact that removes the bacteria from under the gum.
That is really interesting. It's funny because, like I said, I've always had dentists say, oh, don't forget to floss, et cetera, et cetera. But I never had it broken down exactly why.
Understanding why it's so important. And I think that shift of really understanding what is happening while you're in the dental chair, it really helps empower patients. Because when I was a child, when I was young and I went to the dentist, dentistry happened to me.
Yeah.
They're happening in my mouth, and I had no idea why. And it was always a fearful place for me. I mean, it's something that's lived with me my entire life. And when I built the brand, when I built Les Belles, that was my core. My core mission was to eliminate the fear and the uncertainty, and to really empower the patient, to really help them understand the why of everything that we're doing, so that dentistry is not happening to them, that they understand every step of the treatment plan so that they could make that decision. It's a choice that they make. And when it's a choice that we make, it empowers us instead of having to be fearful.
With that being said, even just when it comes to brushing your teeth and whatnot, is there something that you usually recommend to your clients that you feel is superior to then like the standard? Or is it like just toothbrush, toothpaste, make sure it has some fluoride and go to town? Or do you sit there and like, actually those ones that are electronic, because admittedly I might have one of those, are better? What is your thoughts? Because I know there's so many different ones. There's like the sonic, there's the, ones that just agitate,
Yes, there's a huge range of products on the market. And I think it's also really important to start from like the basics. I realized over the years that most people don't know the steps to dental oral care at home. They don't know to floss first or brush first or to rinse first. And there isn't enough education out there to help guide the general public. And a lot of my patients on a daily basis are surprised every day when I tell them you should floss first, use a floss that's about arm's length to get into the gum and to push the bacteria out. Most people floss to get rid of the food in between their teeth.
Admittedly, I floss after I brush my teeth.
Yeah, so you want to...
I want to clean it before you have to go in there.
You want to go into the gum to floss the bacteria out. And then you want to clean your tongue, because there's a lot of bacteria that also lives on the tongue with a tongue scraper, right? And then you brush everything away. And then lastly, you'll follow up with a alcohol-free mouth rinse.
Any reason why an alcohol-free?
Because the alcohol, which a lot of people would use mouthwash with a lot of alcohol because it burns and it feels like something is happening. But the alcohol actually dehydrates the mouth and it dries out the mouth and actually promotes bacteria growth and cavities and gum disease. Yeah.
Oh, wow.
Yeah. We want to use a mouth rinse that is soothing, that has, components like aloe vera, xylitol, and things that will remineralize teeth.
Okay, I'm actually writing this down.
Yeah, alcohol is very harsh.
I didn't know that.
Yeah.
Wow. Actually, you've just blown my mind, because I literally just bought alcohol-free one.
Mm-hmm.
I'm trying to remember why I got that one. I think it was on sale, admittedly. And I was thinking to myself, I wonder if this probably isn't as effective. But wow, that's really interesting. I think I'm going to buy that from now on.
Yeah, it's alcohol is very, very harsh. I mean, it's like washing your face with alcohol. Why would anyone do that?
Well, okay. So before we move on to my next subject, I want to ask one more question, because you triggered something.
Yeah.
Tongue scraper.
Yes.
I've seen them. I've always used my toothbrush to kind of like.
You could do that too.
But I mean, is a tongue scraper more effective?
Again, if it means that it's whatever fits the lifestyle. If you're someone who will carry the tongue scraper and build that into your routine, amazing. But if you're someone who's going to use the toothbrush and the tongue, as long as you're cleaning the tongue, it's that's all that needs to happen.
It's very funny because I'm right now in my head thinking to myself, because like, we can all take personal responsibility for our habits and create new routines. I do that with my skincare. I've done it with my hair care. So why not? But now I'm like kind of sitting here thinking to myself, I need to have a conversation with my kids. Because, you teach the flossing, you teach the brushing and stuff. But admittedly, I think that there are some habits that we need to have a conversation about. Wow.
Yeah, and just really understanding why. Why are you doing something? And just really understanding the why and the connection that the why has on your overall health and on your body. I think that's what's really important, getting that message through.
So, this kind of moves into the next thing I want to talk to you about, because, obviously for our physical health, as you were explaining, it's really important, and I've heard studies about that, how there's a correlation between your heart and your dental health and everything. But let's get into mental health, because I do know of different people in my life that don't have the healthiest teeth. Even cosmetically, they don't look great. And it plays with their head. You don't feel well, but also you were touching a little bit earlier with me about the correlation of someone having some mental health issues and their dental care. So can you expand on that? Because that was really interesting.
Yes, for sure. I think it's especially relevant now after the pandemic, the connection between our oral health, our smile, and our mental health, and how the relationship with our smile impacts our mental health. One of the first signs of depression is when someone when their oral routine starts to diminish. Our smile has such a big impact. And also changing someone's smile could really change someone's outlook on themselves and their entire life. And, I really, it reminds me of a patient, a patient that we did her smile makeover earlier this year. She started seeing me about 5 years ago. And she always was very quiet, a little frustrated, always seemed a little frustrated about, work and something. And we always thought that it was the fear of the dentist and she just didn't want to be there. But from our conversations, we found out that she really lost her confidence because of these veneers that are in her mouth that were done poorly, that she feels really bad about. And over the years, she was really motivated to change her smile and to regain that confidence of her youth. And she saved up for several years. For the past 5 years, she's been saving up. And she works as a secretary. She didn't have the financial means to invest in another set of veneers. She saved up for several years to build her dream smile. And earlier this year, we redid her smile and with veneers. And once we did that, we saw a different person. She started coming to her appointments. She was wearing lipstick. She was wearing bright clothes. She was more optimistic, and she had this bubbly, outgoing personality that we never saw for 5 years.
Wow.
She was reliving her youth and I actually never looked at her chart to see how old she was. And I realized that she was around my age. But
oh, wow.
I didn't know that. I didn't know that for 5 years until recently. And after our smile makeover, she was so appreciative. And we've had a lot of conversations. We had many conversations. And based on our conversations, she really we learned that her smile makeover really changed her life and how she shows up to the world every day. And she was very honest with me one day. And she said that, honestly, the smile makeover saved my marriage.
Oh, wow.
Like, that was powerful.
Well, I mean, confidence and your self-esteem can affect so many different aspects of your life. And it's hard when you think about that. It could be something so simple, so simple. And let's face it, our face and our smile is our expression of joy and love and excitement about life. And if you are constantly covering it, so I once had a conversation with my mom, and we used to always kid around about, like, if you weren't feeling great, smile, you know, and though there is a little bit of a stigma for women, because you do get a lot of people saying, oh, just smile. But when my son is my 12-year-old is really cranky and he's having a bad morning and we're on our way to the bus stop, I will sit there and I'll start smiling. And I'm like, I need you to smile right now. I know you're not feeling it, but smile. Changes your whole perspective. You're suddenly lighter. The physical movement actually will lift your mood. And I think there's clinical studies that show that. So if you have dental issues and you're not smiling ever, oh my gosh, it must affect everything.
Everything. The way we smile, how we smile, and the confidence that we get from our smile has such a huge impact on how we show up to the world and how we connect to people. And it really helps unlock so many opportunities for us. And I don't think that a lot of people recognize that until they are living that transformation.
Right. So let's dive into that, because I think there's a lot of different ways that people can improve on their smile. I mean, there's everything from orthodontia to something as simple as, having your teeth whitening and everything in between. So I want to first start, because there's a couple of things, because I want to jump back to the veneers as well. But I want to first talk about whitening, because I think that is a very on-trend thing. A lot of people do it. I've had it done, and I can honestly say I have mixed feelings about it, because it was not comfortable. I rather do it at home personally. But tell me a little bit about the different stuff, because I do think there's probably more options than maybe I was exposed to.
There are so many products on the market. And it's really important to understand the products. And, even in a professional setting, there's so many professional whitening systems, and we really spend the time to test it all and figure out what works for us. And we pick the best products on the market. We do a lot of market research in our office. So I always recommend for whitening to start with a professional whitening that fits the patient. We always start with a consultation. There is no two patients that are the same. When you talk about sensitivity, when you talk about how deep the stain is. So when patients come in for a consultation, the first thing I look at is the gum and the stains that are in the teeth. So there's a lot of people, I think most people don't really understand how whitening works. One of the first question is, how white am I going to get? The answer is we
want the results.
we don't know. So the way that whitening works is that the whitening gel sits on the teeth, and the components of that gel will lift the stain from the teeth. So it depends on how deep the stain is, how powerful the gel is, how fresh the gel is. It's similar to removing a stain on a white t-shirt. Right? What products do you use on the stain to get the deep stains, get the superficial stains? Some will work better, some will not. So finding that the fit and finding what works for the individual patient is the most important. So in our office, our professional whitening is always customized to the patient. The
That's
time that we spend on each whitening is different for every patient. Some patients will have a take-home component where they wear a whitening tray for X amount of time. And for some patients, we simply do in-office whitening, and that is enough. So
let me ask you something, because this was something that was told to me, is that after you have that whitening service, your teeth or enamel is a little bit more porous. So if you have certain habits like, coffee drinking,
coffee.
You could potentially make the stain worse.
Well, it's like getting a facial, right? You don't want to wear makeup immediately after. So it's very similar.
But I'm not addicted to makeup.
So immediately after whitening, the teeth are more porous, and we always recommend staying away from anything that has colors for 48 hours.
I had to get my sip of coffee in there.
Yeah, if you absolutely have to drink some coffee, drink it through a straw.
Fair point. I actually did do that. I did do that.
Yeah.
I did do that.
And
but I mean, what about at home stuff? What about at home stuff? Because I see a lot of toothpaste that say, and whitening. And I always wondered how valid they are. I mean, obviously it's not going to be like something that you get in service. It's not going to be something that is that impactful. But do you think it has any validity whatsoever?
Yes, 100%. So it's always best. So in-office whitening is always best to tackle the superficial, medium, and deep stains. It's a reset button to get that white t-shirt very white. And what we use at home, and I prefer white strips because white strips really sit on the tooth and it locks in, and you get that 30 minutes or 20 minutes or 5 minutes of constant contact. Or whitening trays, at home whitening trays work really well. Those are good for maintenance. After you have that deep cleaning, that deep stain removal, you maintain it because the stains will accumulate over time, but they start in the superficial layer. So these whitening products like white strips are really effective in removing superficial stains. So they're good touch-ups in between professional sessions. I prefer white strips over whitening toothpaste because most whitening toothpaste, and I've looked into most of them, I've done a lot of market research on whitening toothpaste, they all use some sort of abrasive to scrub off the stain. So more or less over time, no matter how fine the particle is, it will start to affect the enamel. It could cause more sensitivity because it's a scrub. And some are more harsh than others, and you don't know what the particle size is.
No, that makes sense. That makes sense.
Benefits are really good.
I'm glad I asked that question. So I want to talk about veneers, what they are, and because let me tell you, veneers have like a strange reputation, because I think
especially on Google.
Yes, I've seen really bad and I've seen beautiful. They can be expensive. And to make that kind of investment is huge. And you're always worried about what it's going to look like in the end. And you're investing all this money. But that's where I also want to talk about the service that you guys do, which is the Smile Preview, which I mean,
very exciting.
You don't hear about this anywhere. So first, let's talk about veneers and who is the kind of person that would want veneers or need veneers?
Veneers, there's a huge range of veneers on the market. Who wants veneers? Veneers are good for people who are looking to change their smile in a sense where they want to change the shape of their smile. If they have deep stains, they want to change the color significantly. They want to widen their smile. They want a smile that's going to fit their face better. So it's really meant to build a smile that fits the face. That is the goal of getting veneers.
Is it something that can be used as opposed to, like, say, orthodontia, where, I mean, don't get me wrong, I understand some orthodontia, you need, braces or something to that effect. But is there, certain things that you can do as opposed to going to get braces?
Yes, there's certain things that you can't correct with orthodontia, right? If you have small teeth, you could have the straightest teeth, but they're small and you have a big smile. It doesn't matter how much braces or Invisalign you get, it's never going to fill that smile.
My son has one of those and we call it chiclet teeth.
Oh,
poor kid.
So, in cases like that, or if you have deep stains, you have tetracycline stains, and you want bright white teeth, no orthodonture is going to help with that. So there's certain cases where veneers are a good option, and veneers there's really such a huge, there's a huge range of veneers between pricing and how they look. And if you Google and horrible stories, so there's such a big range and mixed feelings about veneers. Veneers today are not what it used to be many years ago. And also when it comes to how the veneers made, there are different grades of veneers. Why is there such a huge cost difference in veneers? Because most veneers on the market are made either by a machine or they're made by a technician that is just making the teeth. But then there are also veneers that are handmade. They're handmade by a paintbrush with porcelain powder. And it takes somebody days to finish a set of veneers.
Wow.
It takes a master ceramist, 5 days to sit and to hand make layers and layers of porcelain to make these contact lens thickness veneers. That those are the most natural veneers, the handmade veneers. It's art, it's a craft. It's not something that you could just hit a button and the machine will process 10 veneers. So
doesn't it make you wonder, like, what kind of person it says, when I grow up, I want to make veneers, hand make them. Because I feel like it does take a certain degree of artistry, right?
Yes, it's definitely an artistry, and it's sad, but it's a lost art because people want things now. People want things faster. People want things cheaper. People want things done immediately. With a machine, you hit a button and you get a set of veneers tomorrow.
I got to tell you something. I'm sorry. I'm just having like a brain thing for a moment. My dad used to tell me, because, he was born in 32, in 1832. So when he was 10 years old, his very first job, I can't believe I just remembered this. His very first job was going on his bike in Brooklyn and delivering teeth that someone handmade to dentists.
Wow.
He would go on his bike and he would make a certain amount of money every week for doing that. I'm sorry. I can't believe I just remembered that right now.
Yes. So you knew this all along.
No, but I never really made the connection. I just figured, that's like, I'm sure it wasn't veneers back then. It was probably replacement teeth and, whatever. But I never really, it was just a silly story my dad used to tell us,
Yeah.
But that's funny.
Yeah, it's huge. There's a huge range, like anything else on the market. Things that are handmade are custom. They're one of a kind, and it takes a lot more time to build that, to make that, and it's an art rather than something that's processed. That's just a copy in a machine that you just hit a button, and it's like obviously that's less. That will cost less.
Right. Well, before we jump onto your smile preview, because I think it is an incredible service and I wish it was more widespread. I do want it because we talked like a couple weeks ago. And because we were talking about the difference between getting veneers and orthodontia, we started talking about at one point about all those I don't know. It's almost like mail away orthodontia, right? Where you can get like these clear things and you shape it. It's braces, or I don't know, like a Invisalign.
Liners that are
right. And how we were talking about, if you needed surgery, you wouldn't do a mail away thing. It's orthogene, it's moving a body part. Like, so you feel as though something like that is just problematic?
Yes, there's a lot of mail order aligners on the market, and as dentists, we all have our reservations because we spent years studying and understanding the teeth and teeth movement and the effect teeth has on the body and on the face. And it's a body part. It's like you're moving a body part. So it's not something that I would recommend for anyone who didn't have that training to do on their own. It's scary. You don't know when things are, even when we do in the office, there are times where we have to do a mid-course correction, or something is not moving the way we think it's going to move, or there's some sort of a force difference that we have to shift and pivot midway. I don't think a person who's a normal person who's doing their own orthodontia without supervision at home could recognize. And that is very, that's not healthy. And the correction usually costs more than doing it with a dentist initially. And
you mentioned that, you get a lot of clients that you have to correct.
Yes.
I feel as though obviously there's something highly appealing to it because, I never had braces, but one of my sons did. And that monthly visit, the tweaking, all these different things, you had to do it forever. And they're making it seem as though it's like a 1, 2, 3, and you're all done, is highly provocative.
Yeah. There's been a lot of advances in dentistry where, for example, in my practice, we do a lot of accelerated clear aligner therapy, meaning that any clear aligner therapy, we could cut the treatment time by 70%. So traditionally, most people who are in clear aligners, they're in it for a year and a half. Our cases in the office finish between a month and 6 months, and most of our cases finish in 3 months because we accelerate it.
Dr. Huang, I need to come visit New York.
Yeah, there are procedures that we could do to accelerate teeth movement, and it's control and it's supervised, and timing is not an issue anymore. We also have dental monitoring machines that we sent home. During the pandemic, we didn't see our patients as often. And we gave them scanners where they could scan their teeth, and I could see their teeth on a daily basis. And I could pull up a picture of their teeth and draw on it and say, chew on this tooth. And I'm with them every day.
Wow.
Technology through a scanner that they have at home, and they plug their iPhone into it and they're able to scan their teeth. And I see it every day. I see the update every day. So timing is not an issue anymore. Convenience is not an issue anymore.
But expertise and regular checking is an issue. So you have to go to a professional.
Yeah. And just, seeing potential problems before it happens. I think that's what's most critical. And with these take-home aligners, there's no guidance. We don't know until it's finished. And
right. So I want to jump into your smile preview because I was completely fascinated by this entire program that you've created for your practice. It's not really something that's done everywhere. So unfortunately, you might not find this in your local area, such as myself. But I think that this is a really exciting concept Tell us a little bit about the smile preview that you do for your clients that are looking to invest a good amount of money on changing their smile.
Yes, the smile preview is something that we started doing in the past 2 years, and it really stemmed from my frustration of fixing a lot of like the patient that I spoke about earlier. She had these veneers done. She had no idea what they were going to look like until they were done, and she's been upset about them. And it changed her entire life, and she had to do it all over again. And we hear these stories and we see these patients every single day. I didn't know they were going to look like this. I didn't want this. And this is not what I thought they were going to look like. And I really wanted to find a way to show our patients what they were going to look like and to make sure that we're the right fit. Because at the end of the day, cosmetic dentistry is an art.
Mm-hmm.
Everyone's art is different. Every session that I do, there are no two pieces that look the same. It's customized. So I think finding the perfect fit is really important. So what we do in our practice before we do anything permanent is it's like a rendering of your smile. It's like, the way I explain it, it's like getting a rendering for your house that you haven't bought yet.
Yeah.
So most contractors are not going to spend the hours and hours to build you this house that you didn't buy the land for yet. It's very time consuming. That's why it's not that it's not possible. It's not done traditionally because most people want to have the security before they invest the time. But for me, it's more of, I want to know that we both have the same goal and we're the right fit before I ever get started. So the smile preview is a handmade design of someone's smile. So patients will come in for a consultation. We take pictures. We take molds of the scans of their teeth. And we make a design based on their facial measurements. We measure the eyes. We use a leveler. We use a special glasses, and we use machines. We use technology, and we get all the measurements of their face, and we put it into a supercomputer where we study the golden proportions of what teeth should look like in, this size eyes, face. And with that, we come up with a design that's on model. And patients will come in for a second visit where we transfer what we feel will look good in their face, in their mouth. And we make this by hand. I use plastic, and I pretty much paint it on their teeth.
Wow.
And it's painted on top of their teeth. No anesthesia, 100% reversible. I paint it on top of their teeth. They get to see what it's going to look like, what's going to feel like in their mouth, and what it's going to look like and how it goes with their face. And we take pictures, and we put the pictures together, and patients go home with the pictures, and we take everything off their mouth so that they can make a decision that on their with what they know, with the smile preview, they can make a decision that they feel comfortable and safe about, and knowing what their smile is going to look like before they ever invest in that smile.
It's really investment. It's interesting because I do feel as though, I mean, don't get me wrong. I think that there is something to be said about a person's professionalism. They know what they're doing, and they're going to sit there and tell you, trust me, it's going to be great. But, even as a hairdresser, I know that, I know what I do is good, but with that being said, it's scary being on the other side. Yeah. And do you think that your, I guess you would say, childhood trauma, going to the dentist and not knowing what to expect, do you think that played a part in the decision of making this? Because I think that's really empowering.
100%. The core of our practice is to be really transparent, to show patients what we're doing every step of the way, and to explain all the options to our patients so that they understand the why. And in terms of a smile makeover, to see the smile preview, they know exactly what they're getting before they commit to it. So that when they do commit to it, it's an empowered decision. It's not a decision where they're going in with fear, like, oh my God, I don't know. I went on Google and the teeth look like this, and I don't want to wake up like this. And, it's a lot of money. It's a big investment. So we want patients to be in charge. I
also feel like when you're in a dentist's office, and it might be one of the reasons a lot of people have a fear of it, there is a sense of loss of control, that you have, like you're just kind of letting yourself go over to something, and it's not always feeling very good either. So it's nice to feel like, because I know you've even mentioned that if they have it on their face and they're able to say, you know what, is there any way we can adjust X, Y, and Z? And if it's in your power, you can do that.
Yes. At that temporary phase, everything is reversible. That is the beauty of it. There's no numbing, there's no pain, there's no injection, there's nothing permanently being changed. It's just a rendering. It's just a design that we could change. We could change anything and everything. And wow, that is powerful. And the patient is in control of that. And it also helps us understand whether we're the right fit, because at the end of the day, it's an art.
Well, with that being said, I feel like I learned so much today, and I'm so appreciative that you came on here, Dr. Huang. It was wonderful talking to you.
Thank you so much for having me.
And everybody who's listening, I definitely think that you should go and look her up. You're on social media, I guess.
Yes.
But also, do you have a website that they can go and take a look at some of your work?
Yes, it's lesbellesnyc.com. It's LESBELES NYC.com. And we also have a very special team member. It's our Chief Anxiety Officer.
Yes, I love him.
His name is Oliver Bell, my little dog, for patients who have a lot of dental anxiety. They could hold Oliver throughout.
I feel like every practice should have an anxiety or an emotional support dog. That is so great.
I know, he's the best. You could hold him throughout your entire visit. And he's just the sweetest little thing. And he's just really changed the practice and bring that safeness to a different level.
It's so great. Well, give a nice treat to him for me. And you have a great day. Thank you for coming on.
Thank you so much. Thank you so much for having me.